Panic disorder is a condition that involves recurring panic attacks. A panic attack is an episode of intense anxiety that comes on without warning. Often, panic attacks don't have a clear cause. Panic attacks cause intense emotions, such as a fear of dying or a sense of being detached from oneself. They also cause physical symptoms, including heart palpitations or shortness of breath. 2 or more panic attacks might be a sign of panic disorder. Treatment for panic disorder includes medication and therapy. Lifestyle changes may also help. Cover commonly prescribed medications for panic attacks and how they work. Prescription medications for panic attacks and anxiety medication can make it easier for some to manage panic attacks and anxiety. Some medications treat a co-occurring condition, such as depression, simultaneously. Selective serotonin reuptake inhibitors, SSRIs. SSRIs are a type of antidepressant also used to treat anxiety and panic attacks. They prevent serotonin from being absorbed by nerve cells in the brain. Serotonin is a chemical messenger associated with mood regulation. Stabilizing serotonin levels helps to reduce anxiety and panic. SSRIs have been widely studied, carry a low risk of serious side effects and are effective long-term. As a result, they're one of the most commonly prescribed medications for panic disorder. Some SSRIs commonly prescribed to treat panic disorder include citalopram, Celexa escitalopram, lexapro-fluvoxamine, luvoxparoxetine, paxil-fluoxetine, Prozac sertraline, Zoloft. Serotonin norepinephrine reuptake inhibitors, SNRIs. SNRIs are another type of antidepressant. They prevent the absorption of both serotonin and norepinephrine, a chemical messenger involved in the body's response to stress. SNRIs pose a low risk of side effects. They're among the most widely recommended medications for panic disorder. Venlafaxine, Effexor, is currently the only FDA-approved SNRI for panic disorder. Tricyclic antidepressants, TCAs. TCAs are an older generation of antidepressants. Although they've become less common with the invention of SSRIs, research suggests they're equally effective in treating panic disorder. TCAs work by increasing levels of serotonin and norepinephrine and blocking acetylcholine, a neurotransmitter associated with anxiety symptoms. Some TCAs commonly prescribed to treat panic disorder include doxepin, adapin, Sinequan clomipramine, anafranil nortriptyline, Camelor amitriptyline, Elavil-diazepamine, norpiriminomipramine, tofranil monoamine oxidase inhibitors, MAOIs. MAOIs were the first antidepressants. They work by blocking monoamine oxidase, an enzyme involved in the breakdown of serotonin and norepinephrine. MAOIs are effective in treating anxiety-related conditions, but they pose a risk of serious side effects when taken alongside certain foods and medications. As a result, they are less likely to be prescribed for panic disorder than SSRIs, SNRIs, and TCAs. In cases where other antidepressants are ineffective, the following MAOIs may be prescribed: isocarboxycet, marplanphenolzine, nardyltranilcypramine, parnate-benzodiazepines. Benzodiazepines cause sedation. They work by slowing down central nervous system function, though their exact mechanism isn't known. While benzodiazepines are effective in treating symptoms of a panic attack, they're generally not recommended for long-term use. They can lead to depression and drug dependence. They're especially risky for people who've had problems with drug or alcohol use in the past. Benzodiazepines such as alprazolam, Xanax, and clonazepam, Klonopin, are sometimes prescribed to treat short-term symptoms caused by panic disorder. Beta blockers. Beta blockers treat the physical symptoms associated with panic attacks. They work by preventing adrenaline from reaching the heart's beta receptors and making the heart beat faster. They also help lower blood pressure. They don't treat the psychological underpinnings of panic disorder. Beta blockers are traditionally prescribed for heart conditions. They haven't been approved to treat panic disorder. Still, a doctor might prescribe beta blockers off-label if they think it's best for you. Some common beta blockers include acebutolol, cectralbisoprolol, zibetacarvedilol, coregpropranolol, indirol atenolol, tenormin metoprolol, Lopress or other antidepressants. There are other antidepressants available. Most work by stabilizing serotonin or norepinephrine. Other antidepressants include duloxetine, cymbaltitrazidone, desarelmirtazepine, Remeron. Can you get panic attack medication over the counter? Panic attack medication isn't available over the counter. You need to see a healthcare professional to obtain a prescription. Panic attack natural medicine. While some natural remedies appear promising in treating panic attacks, more research is needed to explore potential risks. Keep in mind that the Food and Drug Administration, FDA, doesn't subject herbal remedies, dietary supplements, and essential oils to the same standards as medications. As a result, it's not always possible to know what you're taking. Natural remedies can interfere with your medications and cause other side effects. Ask a doctor before taking a natural remedy for panic disorder. Panic attack treatment without medication. Research trusted source has shown that cognitive behavioral therapy, CBT, is the most effective form of therapy for panic disorder. It can be used alone or in combination with antidepressants. CBT is a practical form of therapy that encompasses a number of techniques. The goal is to adapt your thoughts and behavior to improve panic disorder symptoms. Other non-medical treatments for anxiety include lifestyle changes, exercise, and relaxation techniques. Treating children with panic attack disorder. Treatment for children with panic disorder is similar to treatment for adults with panic disorder. Typical treatments include medication and therapy. SSRIs are among the most commonly prescribed drugs to treat panic disorder in children and adolescents. Since SSRIs aren't effective right away, benzodiazepines are sometimes prescribed to manage panic attacks in the meantime. Panic disorder symptoms. Panic disorder is characterized by recurring panic attacks. During a panic attack, you might experience the following symptoms: sweating, chills, or hot flashes, racing heart, difficulty breathing, tightness in the airways or chest, shaking, nausea, abdominal cramps, headaches, dizziness, numbness or tingling, overwhelming anxiety or fear of losing control, fear of death, a sense of detachment from oneself or reality. If you've experienced a panic attack, you might fear having another one or even avoid places or situations where you've had a panic attack. Panic disorder causes. Panic attacks resemble the body's natural response to danger. However, it's unclear why they occur in non-threatening situations. Factors such as genetics, environment, and stress all play a role. Some risk factors include having a family history of anxiety disorder, significant stress, such as the loss of a loved one, unemployment, or a major life change, traumatic event, smoking, drinking a lot of coffee, childhood physical or sexual abuse. Diagnosing panic attack disorder. It's important to see a doctor if you're experiencing panic attack symptoms. They can help you determine the reason for your symptoms, and distinguish between panic attacks, panic disorder, or another condition. They might conduct the following tests to make a diagnosis: a comprehensive physical exam, blood tests on electrocardiogram, ECG/EKG, a psychological evaluation, including questions about your symptoms, medical and family history, lifestyle, and childhood takeaways. RIS and SNRIs are the most commonly prescribed medical treatments for panic disorder. However, other medications are available. If you experience panic attack symptoms, speak to a doctor about your treatment options.